And so without further ado, we'll now be giving the floor to Yusek Mirna. Good morning po, Yusek.
Good morning, Ms. Rina. Magandang umaga sa lahat ng ating mga media partners at saka lahat ng nanonood at nakikinig sa ating media forum today. I'm happy to report to you the accomplishments as far as the vaccine rollout. So, Ms. Rina, with your permission, can I have my slide shown? So, as of kahapon po, may nabakunahan na tayo, if the slide is ready. 60,406,424 jobs na po tayo. Next slide, please. Of this, nakatala po tayo ng 932,000 jobs for the day, and we had almost 3 million, 2.9 million weekly accomplishment, with fully vaccinated of 27.7 million individuals and 36.2 million individuals with their first dose. And we have received 108 million doses of vaccines from the start, and we have deployed 87 million already to the areas. Yung iba are in transit and being deployed to the different regions, provinces, and cities and municipalities. The next slide will tell us the breakdown of our jobs. Next slide, please. According to priority groups. And we are happy to almost complete our A1. These are the workers in frontline health services, our first priority population group. At 99.75% one dose and 95% fully vaccinated. Our senior citizens slowly inching up, but we still need to push. We are at 63.46%. 5 million out of 8 million senior citizens have already received their first dose, and 4.7 million out of the 8 million, so about 57.98% received their 2 doses or the 1 dose J&J vaccine. Our comorbidities, A3, are good. Yung ating pediatric A3, we have started our 12 to 17-year-old with comorbidities, targeting 1.2 million all over the country. And we have started October 15 with NCR. We have nationwide rollout October 29. So meron na po tayong 40,419 12 to 17 with comorbidities na nabakunahan na. That is 3.18%. And today, we are officially launching our pediatric vaccination for the rest of the 12 to 17-year-olds. So hindi na lang with comorbidities nationwide. So pag nagbakuna na, it will be 12 years old and above sa ating mga bakuna center. But of course, sa ating mga 12 to 17-year-old, kailangan kasama yung magulang, may consent, etc. And we have a rest of the adult population, 1.4 million at 8.7 coverage for first dose and 2.2% fully vaccinated. Next slide, please. Ito naman po yung coverage ng by region, no? So ang target po natin ay 70% of the 2021 projected population. So sa second column, again, let us be refreshed. This is the population for 2021. Atin nababakunahan, ito po yung third column, yung 70%. So for NCR, 9 million out of the 30 million population, no? And they have already 99.42% first dose and 88.13% fully vaccinated. Let us remember that for NCR, kasama na po yung mga from other areas, no? Kasi inallow natin by place of work ang bakunahan ng ating NCR, no? So you will see the different regions. Pumapangalawa sa NCR for first and second dose are ISCAR at 55.28% and 39.37% respectively. Yung ibang rehiyon po na malalaki na binigyan natin ng maraming bakuna sa umpisa, these are Region 3, Calabarzon, Region 7, Region 6, Region 11, and even Region 10 humahabol na. So they are now increasing their coverage, one dose and our fully vaccinated first dose. For BARM, we are at 9.8 fully vaccinated and 12.78 individuals with at least one dose. I think that's the last slide. For the pediatric population, our target is 12.7 million individuals with comorbidities, sinabi natin 1.2 million. Thus, yung 11.4 million are the rest of the pediatric population. And you see the breakdown of this pediatric population in the attached table, no? So for NCR, with comorbidities, 144,000 ang target. And kailangan mga 2 dose yan ng Pfizer o kaya Moderna. And may mga 1.2 million the rest of the pediatric population. Pinakamalaking target ang Calabarzon, 1.6 million rest of the pediatric. Then sumusunod po ang Region 3. Sila po ang mga malalaking populasyon and they are the ones with big children population. So we will now target all the regions. We have started the comorbidities last October 29. We are starting the rest of the pediatric officially November 3, and full nationwide implementation by November 5. We are targeting to at least vaccinate 80% of the 12 million, so that will be about 10 million by December 2021. Next slide. So yan lang po. Maraming salamat. We're now open for your questions, Ms. Rina. Thank you.
Thank you so much po, Yusek. Before we proceed with the question and answer portion of this kapihan session, we would like to again remind our media partners to try to limit your questions to 2, and if you have any clarifications, we can have another round for such. First, we'd like to have Red.
Hi po, good morning po, Yusek.
Morning, Red.
Yes po, good morning po. Clarification po, 70% po na yon is 18 and above. Hindi po ba yon kasama yung PIDYA?
Hindi, kasama na yung PJ yan. Yung 70% of the population includes 64% of the adult population and about 6% of the pediatric. A-adjust natin, hindi pa lang na-adjust doon sa target. We will soon be adjusting and expanding our dashboard, no, with the help of our other partners, no, UNDP, Thinking Machines, and the others, no. So titignan natin. But at the moment, ang target pa rin natin ay 70%. So it includes 64%, 18 years old and above, and yung remaining 6% are the 12 to 17. So idadagdag pa natin yung remaining 12 to 17 population.
Okay po. Okay, so clear na po na 70, that's yung 70% figure is 12 above na po yon.
It includes some of the 12 and above, no? Kasi yun ang original target natin. Kasi kung malaman nyo, yung initial target natin at the beginning of the National Deployment Vaccination Plan nung last year is really 16 and above. But we changed it to 18 years old kasi nga yung consent, and then many of the vaccines are 18 for 18 and above. So ginawa nating 18 muna, and then nung meron na tayong EUA for 12 to 17, so we are now starting 12 to 17. I-readjust natin yung ating mga target na 70% population.
Last question po, Yusek. Clarify ko yung tinanong ko po sa inyo like yesterday sa Laging Handa about doon sa proposal ni Congressman Salceda na ang dapat daw kunin daw na vaccines is yung mga western or yung mga branded or western brand vaccines. Kasi ang sabi po ni Salceda kasi dapat daw tanggapin daw ng katotohanan na ang mga gusto daw ng Pilipino ay mga western brands. So what can you say about this pong suggestion na ito na ni-raise ni Congressman Salceda na parang mas gusto daw po ng Filipinos ngayon yung western brands as opposed doon sa Chinese or Russian brands. And what do you want to suggest to Congressman Salceda na of course this could create an unnecessary hesitancy palalo sa ating mga kababayan. Yun lang po. Salamat po, Yusek.
Tama ka, Red. So if Congressman Salceda is talking about the Western brands, there is the general perception na mas gusto nila ng Amerika. Nandun pa rin yung ating colonial mentality na pag US gusto natin, no? But it will be up to our experts and our vaccine SAR who are doing the negotiation together with our DOH kung ano yung available brands. We cannot limit to our Western or American brands kasi hindi naman natin alam yung availability. Supply is still an issue if that will be widely available. But I do not agree completely na ang gusto ng tao ay Western brand. There are still those who like the Russian Sputnik V and the traditional Sinovac. Marami pa rin ang may gusto ng traditional method, yung ating inactivated na Sinovac. And studies are showing na they are all efficacious. They are now effective. Tinitingnan lang how long the immunity lasts for these different brands. Remember, we are still emergency use authorization, so wala pang CPR. So may mga kailangan pa rin silang i-prove during this time na nagbabakuna tayo. Minomonitor ng ating mga vaccine manufacturer, yung mga side effect, yung stability data. Tapos may mga iba't ibang pag-aaral sa buong mundo for the different vaccine brands.
Okay po. Salamat po, Yusek. Salamat, Ina.
Thank you, Red. Thank you rin po, Yusek. Next question we'll have from Sophia Tomacruz.
Morning, Yusek.
Morning, Sophia.
Morning po. I'd like to ask first about a proposal raised by I think some members of T3 to allow family vaccinations, no? Kasi parang it would be one way to reach seniors who are yet to be vaccinated, and then 12 to 17-year-olds who are now eligible, and then also yung mga unvaccinated adults. So kung household approach daw, what's the DOH's view on this, and is it something that the NITAG is discussing?
Yes, we have already allowed the opening of the rest of the adult population. So pwede na yung pamilyang pumunta. Now with the opening up of the rest of the pediatric population, 12 to 17. So ang bakunahan ngayon talaga is 12 to 17 na. Although dapat may mga fast lanes tayo sa ating mga priority groups, especially our A3. And we are hoping that with the opening up of our pediatric age group, maingganyo na rin yung ating mga lolo, mga lola na magpabakuna. Except that pag nagpabakuna ng bata, we need a bigger space kasi dapat kasama yung kanyang parent or guardian during the vaccination. But we have been open. Importante na pamilya-pamilya ang napoproteksyonan, di ba? if the whole family is vaccinated, then they are protected. So we agree with that proposal, and it is already being done in many of the areas, space, and ano yung kanilang strategies, considering whatever is available for them.
Second question lang po, Yusek. Ano na yung status for the plans for third dose for the immunocompromised? Will that come before? Kasi diba mas definite yun versus, for example, the boosters that are expected to come later this year. Ano na yung status po for the third doses? And then later on na rin sa boosters, sapat pa ba yung supply, at least for health workers and senior citizens?
Maybe you have read about the recommendation of the Health Technology Assessment Council that was approved by the Secretary of Health, proposing boosters or third dose for immunocompromised, third dose, and then boosters for our healthcare worker and our senior citizen. No? So in a way, that is an approved principle. Government is now planning. Ang kailangan lang natin, Sophia, yung EUA ng booster. Kasi yung ating EUA ngayon is for 2 doses for a 2-dose vaccine and 1 dose for J&J. That's one. Pangalawa, kailangan din natin hintayin yung final WHO SAGE, Strategic Advisory Group of Experts recommendation kung ano yung kailangan ibakuna, how long the interval, etc., etc. Para at least when we are ready for that, hindi tayo mag-a-adjust ng ating mga polisiya, naka-align tayo sa kanila. So immediately, kung by the middle of this week, after they have met, can be earlier or a little later, we will be ready to roll out. And you are correct, ang uunahin natin ay ating mga healthcare workers. We have about 1.9, almost 2 million based on the data presented. No? So nagtatali na kami, nag-iimbentaryo na kami nung anong mga health workers na nabakunahan na, kailan ba sila nabakunahan, ano yung mga binakuna sa kanila. Many of them Sinovac, 6 months na yan, tapos some of them AstraZeneca. So kung ano yung recommendation, we can have parehong bakuna. So Sinovac, we have available Sinovac until December. We also have, kung heterologous, AstraZeneca, may mga donation, tapos mga private sector procurement. Tapos kung Pfizer and Moderna, we will be procuring Pfizer. Tuloy-tuloy po yan hanggang end of the year, including Moderna. And we have received word that COVAX is also giving us some Pfizer vaccines.
Wait, sorry, clarification ng Yusek. Paano po yung third doses naman ng immunocompromised? Is the DOH, how will the DOH go about that? On the initiative of the immunocompromised patient themselves to get that third dose, or is the DOH going to try to look for them through their doctors, or paano yung approach dito po?
Yung sa mga immunocompromised, there's a certain group of patients. No? We will talk with our patient groups, we will talk with our doctor groups para malaman natin where they are. We have a record of them in many places. So we will also track them. We are already starting to track them kasi nga kasama sila sa mga mabibigyan ng mga third dose. No? Yung mga operational details lang ang mga fina-finalize natin, Ms. Sophia.
Okay, salamat po, Yusek.
Thank you, Yusek. Thank you rin, Sophia. We would just like to remind again our media partners to limit your questions muna to 2 questions, and then we'll have another round for the clarifications. So we could accommodate lahat ng mga questions that we have from our media partners in the call. Next question we'll have from Dreo Calonzo.
Hi, good morning, Yusek.
Yes, Dreo, good morning.
Yusek, so recently, diba na-hit na natin yung 100 million na deliveries. Pero yung na-administer natin is around 60 million pa lang din.
Yes, you are correct.
Nasaan po yung 40 million na and then if you can provide details on alin yung nasa warehouse pa, alin yung on the way to the regions, ganon. And yung again, I think this has been asked of you and Secretary Galvez, pero saan po tayo nahihirapan in particular to address the gap dun sa throughput and paano natin yun ina-address po? Thank you po.
In terms of, thank you, Dreo. In terms of the doses, you're correct. We have received 108 million doses and we have deployed 87 million doses. So about 11 million are in the national warehouse. Pag sinabi nating national warehouse, it includes the DOH warehouse and which is PharmaServe, and Swilig Pharma, which is the warehouse, the central storage for our private sector and LGU procured vaccines. So if that is about 87 deployed versus 60 million naman na na-job natin, where is the rest of the 27 million doses? Some of them are in the regional offices. If my memory serves me right, it's about 7 million. And the rest are in the provinces and in the cities based on the inventory that was submitted. Saan tayo nahihirapan? Unang-una, from the central to the province or the region, nahirapan tayo kasi we need to wait for papers, we need to wait for certain documents bago ma-release yan. Pangalawa, dapat ready yung ating mga areas to receive some of the vaccines, no? Yung mga nandoon sa ating mga probinsya, dapat binababa. Bakit hindi tayo nakaka-throughput? Kasi hindi nila ginajab. Simulat sa pool, ang ating prinsipyo, once you give the vaccine, dapat in 5 days na i-jab na lahat yan. Tapos pag na-receive yung vaccine, in 3 days, 3 to 5 days, dapat na i-deliver na yan sa mga areas, no? But ang isang problema, hindi pa nakukuha yung cadence. Yung ginawa nila kasing business as usual. Yung dating bakunahan, parang ganun pa rin ang isiisip ng ibang mga healthcare worker, mga nasa probinsya, nasa region. Kailangan mabilisan na. Pag nandyan na yung bakuna, emergency yan, ibakuna agad. This is the difference with NCR, no? Very aggressive, very progressive, na-develop na yung tinatawag nating cadence, yung practice ng ating mga mayors. Pag may bakuna, alam na nila kung sino ang babakunahan, ano yung schedule, nag-increase ng vaccination sites para ma-meet nila yung target. Now we are giving the different provinces, cities, and municipalities targets para maka-achieve ng at least 1 million to 1.5 million per day. So, meron na rin kautusan na may DILG memo si Sec Anyo directing our local government units na pag nagbaba ng bakuna within 3 days na ibigay na sa mga health center yan, na ibakuna yan, and within 2 weeks sana nabakuna lahat yung kanilang mga doses. Of course, we need to store some of our second doses sa mga areas na pwede nating i-store at may capacity, either sa province or yung mga tinatawag nating spokes, hubs, yung ating hubs na merong capability to store for a 21-day interval or a 28-day interval. Many of our AstraZeneca na 12 weeks interval, pinapadose na natin as first doses. Tapos yung mga susunod na delivery, sila na lang ang second doses.
Ma'am, so bakit po hindi pa rin nakukuha na regions yung outside Metro Manila yung cadence ng pagbabakuna? I think we've done several time in motion, di ba, on that. So bakit po hanggang ngayon hindi pa rin nila nakukuha?
We will have to push them. Kailangan na may surge, so wala. It should be their responsibility. Yan ang pagkakaiba noon sa mga mayors, no? ng NCR. They were working as one, they were acting as one. They wanted to bring back the economy and the safety of the residents fast. Etong ating mga nasa iba-ibang LGU, nasanay kasi sila na konti ang unang dumating sa kanila. Ngayon na madami nang dumadating, kailangan i-push ng i-push. Tulungan natin, tinutulungan ng ating mga regional offices kung paano magplano at paano mag-push. Ang isang factor na initially nakita natin, yung pagkaroon ng surge sa ibang areas, na-compromise yung ating mga magbabakuna. So, nag-stop sila ng bakuna o kumonti yung kanilang HRH. So, we are looking at additional vaccines, additional HRH to augment the LGU workforce. Hopefully, pag nabigyan na natin ng mga target nila, ganyan ang ginawa din natin sa NCR. Pag hindi nila na-meet yung target nila, tinatawag natin. Pag kulang na yung bakuna, nagre-replenish. Ganun ngayon ang gagawin natin sa ibang area para ma-establish yung cadence nila.
Thank you, Yusek.
Thank you, Yusek. Thank you, then Jeyo. Next question we'll have from Lay Alvis.
Good morning po, Yusek.
Morning, Ms. Lay.
Opo. Yusek, sa US po, nagsimula na po sila ng vaccination ng Pfizer sa 5 to 11 years old. Napapag-usapan na rin po ba ito? Nasa pipeline na rin po ba natin ito?
Yes, we are considering, we have considered that in our plans for next year, vaccination of below 12 years old. At alam naman natin ang proseso natin sa pagbabakuna, di ba? Kailangan may Health Technology Assessment Council recommendation, tapos kailangan yung, tapos ano yung bakuna na bibilhin na pwede sa, ano yan, below 11 years old. But napag-uusapan na yan at linagay na ng ating mga planners ng programa for next year.
Okay. And then second question, Yusek, yung sunog po sa Zamboanga del Sur, may update po ba tayo kung ano po yung nangyari doon at bakit po napakarami po nung naka-imbak na bakuna nila? 148,000 na nasayang po sa sunog.
Nag-fire yan. I don't know the cause. I have not read it. I was more concerned about the vaccine. Yes, about initial report is about 148,000 doses yan na Moderna, Sinovac, AstraZeneca. Pinakamalaki ang Pfizer na deliver ng October 25. But yung sunog ay October 31 ba yun? So you are correct, the DOH and the DILG will now investigate bakit hindi na i-move kaagad yung mga bakuna. We are thinking that naging parang storage space itong ating PHO for the second doses, but nevertheless, kailangan malaman na bakit hindi na i-move yung bakuna. May DILG memo naman, so yun ang sinasabi ko, hindi nila na-establish yung cadence. Hindi pa nila nakita na kailangan i-distribute at ipakuna yung mga bakuna. But we will investigate joint DOH and DILG with a show cause order as instructed. Thank you, Lay.
Thank you po, Yusek.
Thank you, Lay. Next question we'll have from Greg.
Good morning, Yusek.
Morning, Greg.
Yusek, first to clarify lang po, yung start natin ng pediatric vaccination among all of 12 to 17 today is nationwide na po ba or from NCR pa lang?
No, it's nationwide for those who'd like to start already, although based on the experience of the comorbids, some of the LGUs even started earlier with the rest of pediatric para ma-test ba nila anong kaibhan, ano ba yung pace. But November 3 is kick-off kung sino na ang ready. And then November 5 is nationwide. Technically, parang may marker lang tayo, may mga milestones tayo, but they can already start if they are ready.
All right. Yusek, may we get your views po on this call of Senator Gatchalian for the resumption of face-to-face classes based on cities or areas with highest vaccine coverage daw po?
We are one with the senator in wanting to resume face-to-face classes kasi matagal na pong kulong yung ating mga estudyante, and sabi nga nila hindi mapapantayan yung school learning atmosphere with their classmates and with their teacher kaysa yung naka-virtual. We are ramping up our vaccination for our DepEd teaching and non-teaching personnel. They are way above 50, medyo mabagal-bagal ng konti, but we are working on that. Sa CHED naman, almost 90% na yung teaching and non-teaching personnel nila. So, together with the Chair Popoy de Veras sa CHED, nag-iikot siya para mabakunahan pati yung mga estudyante 12 to 17 and before yung mga above 17 nung hindi pa tayo nagbukas ng pediatrics para maumpisahan na itong face-to-face mga classes. But let us remember, may joint memo circular ang DepEd at saka DOH. In addition to vaccination, ano pa yung mga standards na kailangan ma-maintain pag nag-face-to-face na?
Alright, Yusek. Thank you po.
Thank you, Yusek. Thank you then, Greg. Next question, Caroline Bonkin.
Ma'am, just a follow-up lang po. Ma'am, dun sa vaccine hesitancy, may mga nakausap po kasi kami na ayaw nilang magpabakuna talaga kasi una po natatakot sila din sa side effect or feeling nila hindi na nila kailangan dahil nagka-COVID na sila, or sabi nila may mga nababalitaan silang namatay. Ma'am, siguro your message na lang po and word of assurance para sa mga tao na yon. Thank you po.
Yes, thank you, Ms. Carlin. Unang-una, gusto nating sabihin, vaccination is now open to all, especially those who are ready and willing. 12 and above, okay na yan. Sa mga may hesitancy pa rin, lahat tayo, kayo, ako, our friends in media, our celebrities, our family friends should be the role models and help encourage, no? There was an earlier query on vaccination as family. Importante yan, no? Importanteng protektado tayo lahat para protektado ang ating families. Masusi pong pinag-aralan kahit EUA pa lang ito. The benefits outweigh the risks. So wag ko kayong magatubili na magpabakuna para safe po yung pamilya ninyo at saka yung mga kasama nyo sa workplace, kasama nyo sa community. Kung may mga agam-agam, don't hesitate to call any of your healthcare workers who are willing to explain kung ano yung mga concerns ninyo. Thank you, Caroline.
Thank you, ma'am.
Thank you, Caroline. Thank you rin po ulit, Yusek. Next question from Kathleen Davila.
Hi, good morning po, Yusek.
Morning, Kathleen.
Hi. May pediatricians po na nagsasabi na yes, important po ang vaccination ng adolescents and children. But kailangan daw po ang priority pa din ang adults kasi sila ang source or sila most likely ang magiging source of infection. What's your take on this po and ano ang strategy ng government with this kind of concern?
Yes, initially kaya ho na nag-priority yung tinatawag nating sectoral, di ba? A1, A2, A3, A4, and A5. So importante yung ating mga senior, A2, A3, yung mga comorbidities, kasi sila nga ang magkakaroon ng sakit na mas malubha, requiring hospitalization. And our deaths are usually from the 60 and above. Kasi sila ang most at risk at saka most vulnerable. Pero hindi rin natin maikakaila that we also need to vaccinate children. In some countries, some of the anong tawag dyan, surges go to younger children. It's not happening in the Philippines yet. But ginawa naman natin, nauna na yung mga adult population natin. Tapos ngayon tayo magbakuna ng mga bata. Hopefully, with opening up of our rest of pediatric population, maengganyo na rin yung ating mga senior at saka yung may ating mga comorbidities na magpapakuna. Thank you.
Thank you.
Thank you, Kathleen. Thank you rin po, Yusek. Next question from Aiko Miguel.
Good morning po, Yusek.
Yes, Ms.
Yusek,
Aiko, good morning.
Yes po. Yusek, just like to ask, ano po yung current vaccination rate natin? And of course, with the opening up of or the escalation of alert level 2, if possible, by mid-November, ano po ang ina-expect or target nating vaccination rate during the holiday season?
In terms of the rate, mostly jobs ang ating tina-target. So, may sinet ang DOH, NTF, yung ating vaccine SAR, na mag-target tayo ng 70%. So, yung 70%, ito yung 77 million. At least having a first dose by end of November, i-push natin ng i-push yan. Then at least 50% of them will have their second or complete dose by, anong tawag dyan? By end of this year, no? We need to set high targets para ma-push yung ating mga LGUs, yung ating mga bakunador, lahat tayo, para maka-aim tayo ng mas magandang coverage. Although we are looking at the first quarter to vaccinate everyone. Ang pedya naman, ang gusto natin, at least 80%. Sana mabakunahan sa mga 10 million children, then we will add a few, the remaining adults mabakunahan ng first dose at saka first dose by November and then second dose by end of December.
Daily po, Yusek, ina na po yung jobs na naaabot po natin, especially in NCR?
Noon, we reached about, the highest we had was about 700. We had one time 900. Ngayon, naka 900 tayo. When we had the J&J, kasi one dose vaccine, everybody wanted the one dose vaccine. For NCR, I don't have their job rates, but they're at 300 to 500. No? Kasi nga, mataas na yung coverage ng NCR. Noon, they're hitting 500, 600 nationwide yan. So they contribute about 200 to 300. Now, I think they're doing about 100,000. But with the child population, we hope they can increase their targets for children para if they can reach more than 80% of their children population by the end of this year ng 2 doses.
Miss Farina, sorry, one last follow-up lang po sana.
We'll have another round for the
Thank you.
So for clarification, we'll have Sophia.
Hi, Yusek. Quick follow-up lang po sa question ni Carlin. Ano po yung mga active efforts ng DOH to address vaccine hesitancy? May mga ongoing parang communication campaign ba kagaya ng ginawa ng DOH dati for the measles campaign, for example, after the vaccine na parang nag-house to house sila, communication, nag-uusap sa mga nanay at tatay. Ano po yung mga active efforts to address this? Kasi diba parang masyadong malaki pa rin yung percento ng population na medyo hesitant pa.
Yes, in the sense, yung pag sinabi mong malaki, we are talking about high of 26 and I don't know the laws, no, based mga one-fourth pa yan, one-fourth of the population may hesitancy pa rin. Yes, our Health Promotion Bureau, our PCOO, our government media outlets, PIA, and together with our T3 partners are putting their heads together to craft the messaging. Kakaiba ito sa dating messaging kasi alam naman ito social media ito. We start with persuasion, ano ba yung benefits, meron tayong mga fact check, etc. etc. mga nudges, no, kailangan magpabakuna ka kasi ganito ay nagpapabakuna na. And then we're now looking at incentives and disincentives para sa mga nabakunahan. So kung hindi ka makuha sa moral persuasion, baka makuha sa incentive and disincentives. And then if you heard, meron tayong raffle, bakuna raffle with assistance of the private sector and PAGCOR. So yung mga nabakunahan entitled to one ticket. Yung mga senior citizen ay entitled to 2 tickets. Tapos may bakuna raffle. I don't know when they're going to start. Maybe our comms group here who are hosting us today will have an idea kung kailan na ang kick-off na sa mga... And then some of the areas are giving yung 1 kilo ng bigas or other incentives that can persuade those who are hesitant to be vaccinated. Of course, tama ka, Ms. Sofia, kailangan pa rin yung face-to-face, especially yung senior citizen who cannot be attending our town halls, di ba? Who are not social media savvy. So, pag medyo bumababa na yung mga kaso, many of our health workers, our educators are already going down to have some form of face-to-face communication, especially those who are hesitant in many areas.
Salamat po, Yusek.
Thank you, Sophia. Thank you po ulit, Yusek. Next clarification from Greg.
Hi, Sec. May I ask lang po if the government is already in talks with Pfizer for vaccines that may be used to children 11 years old and below po?
Greg, as I mentioned, no, we will have to wait for the vaccine expert panel. Ano ba ang recommended na dose for our below 11? Tapos sa ating Health Technology Assessment Council, kung ano yung mga titignan nila. And then our FDA, kung mabibigyan ng EUA. No, but you are correct. It looks like it's Pfizer and even Sinovac that have initially started their pediatric below 11 years old, 5 to 11 vaccination. This is in the horizon. Yes, they have, it is up to our vaccine SAR and our negotiating panel together with our advice from our planning and policy team of the DOH to look at the, pwede na ba yung bata below 11?
All right. Thank you, Yusek.
Thank you
Ms.
po,
Lina.
Yusek. Thank you, Greg. Next question we'll have from Red Mendoza.
Yusek, clarification lang po. Kailan po may lalabas po yung expanded po natin na dashboard which includes po yung numbers po from yung breakdown po per region? Are we going to expect this within the month po ba?
Yes, we are expanding our dashboard to include by province, their jobs and their inventory. Siguro after 1 or 2 weeks, tinitingnan lang natin. Gusto naman natin bigyan ng partida itong mga probinsya, no? So ngayon lang talaga, although we already had initial talks October 22 with the DILG na kinausap itong mga selected governors and ating mga mayors and city and municipal mayors na pag-ibayuhin, you ramp up their vaccination. We will now give them some time to really finish their vaccination, to ramp up. Before in 1 or 2 weeks, we will now have a dashboard for provinces para alam kung ano yung kanilang mga accomplishment versus their inventory.
Mm-hmm. Magkakaroon po ba ng parang data drop po ba or something like yung para at least po may parang paggamitan po na parang para magamit po ng media para sabihin po natin if you're going to use graphical data or what po. Parang magkakaroon po ng data drop ng vaccine or doon na lang po talaga magde-depend doon sa dashboard lang po as my final clarification po.
We will see what will be the final form, although even the President has mentioned, di ba, na i-announce kung sino yung mga ano yung mga accomplishments. So we will update you of the final final format of the dashboard. But eventually sana accessible to all so that you can compare, and then necessary actions can be undertaken.
Okay po. Salamat po,
Thank
Yusek.
you,
Salamat,
Yusek. Thank you,
Ina.
Red. Next question from Deo. Would you have any clarification?
Yusek, hello po. Yusek, yung figures lang kasi dun sa kanina, yung about the throughput, hindi po nagtatali kasi 108 million doses yung na-receive natin. Tapos, 11 yung nasa national warehouse, 87 yung deployed. May kulang po na 10. Bali, 98 lang po yung...
Mali yung aking mali yung aking computation. Pasensya na.
Okay lang po.
Kasi as we're talking also, ano yun, nagdi-deliver din sila. So,
okay po.
Yes, I stand corrected, Dreo.
Saan po yung adjustment? Alin po in particular
Tama yung 108,000 doses na na-receive natin.
108 million po.
Yes, 108 million doses. 87 ang na-deploy na as of October 31 ba yun yung data. So, mali yung addition ko. 21. Yes, 21 million. Many are already on their way to being delivered. Kagaya ng sabi ko kanina, some of them are in our PharmaServe warehouse. This is the DOH Central Store. And some are in the Sulig Pharma warehouse kasi yung mga procured ng private sector at saka yung mga LGU procured na AstraZeneca are with Sulig Pharma. But majority are still in the PharmaServe. This is the DOH Central Warehouse.
Okay.
Tama ka, 21.
21 po yung...
My mistake. Ang nasa
central warehouses
stores,
or storage. Okay.
Which
Thank you.
in transit. Yes. May mga delivery kasi yan. Ang titignan ninyo, hindi ho kasi, may limitation din kasi sa aeroplano. Hindi pwede po yung dry ice sa aeroplano. Tapos may certain volumes lang na pwedeng i-deliver depende sa planes. No? So talagang ini-schedule para mabilisan. Otherwise, the others, they can deliver by yung mga trucks by land. Thank you.
Thank you po, Yusek. Thank you, Dreo. Next question from Lay Alvis.
Yusek, follow up ko lang po yung sa sunog sa Zamboanga del Sur. Marireplenish po ba kaagad yung mga nasirang bakuna?
Yes and no. Yes, in the sense na yung mga second doses, kasi may mga immediate second doses na nangangailangan. So ang ginawa po ng ating regional office ng Region 9, meron silang stock sa CHD warehouse, dinistribute nga diretso sa mga areas. No? So yung mga ibang Pfizer may not be readily available, naghanap pa tayo ng paglalagyan ng storage. So I think as of yesterday, meron ng mga 3 freezers na pwedeng paglagyan ng ating mga vaccine na Moderna or Pfizer. Alam naman natin kung Sinovac lang at saka AstraZeneca, the regular refrigerator will do. But for Moderna and Pfizer, they need a ULF. So tinitingnan natin yung capability kung saan pwedeng store. But those who are due for second doses, binibilisan natin ma-replenish itong mga areas para maibigay nila kaagad.
Tapos Yusek, yung sa pediatric vax, kailangan daw po ba ng scheduling?
Depende yan sa LGU, no? Mas gusto nila kasi na naka-schedule para at least na pre-prepare yung space. And then for comorbidities, kailangan na they know what to watch out for, no? Yung mga nagsi-seizure, yung mga hyperactive, may mga neurologic, may mga ibang deformities. But for the rest of the pediatric, kaya some of the LGUs started some earlier than November 3 para lang makita ano ba yung nag-experiment, nag-practice kung ano ba yung mga areas na kailangan. So we will see, it will be dependent on the different areas, ilan ba yung available na bakunador nila. And yes, I forgot to mention, sa pediatric kasi, both comorbids and regular, the rest of the pedia, iba kasi yung ating response na gamit, yung pang-adverse event, no? May pediatric equipments na tinatawag tayo, no? Mayroon tayong pang-pediatric BP cups, meron tayong pang-epinephrine, tapos just in case kailangan ma-intubate, worst case scenario, may pediatric ano yun, pediatric na magagamit, mga equipments na pwede nilang magamit.
Last na po, yung sa AFI lang po sana sa pediatric group. Latest po na AFI figures.
I don't have the latest, but I think it was 36 pa yan, yung last na data. We have about 36 out of the 30,000. I don't have the figure, but ang alam ko, I'm sure, dalawa ang ano yun, anaphylactic reaction, nag-anaphylactic shock. So, nabigyan ng epinephrine, some required oxygen. Yan din, kailangan ng oxygen in some of the areas. Tapos yung karamihan na 30 plus cases are minor. Yung tumaas ang BP, sumakit ang ulo, may urticaria na ng konti, may rashes, sakit, sakit sa site, may nag-headache, tapos yung mga anxiety reaction, yung tumaas yung heart rate, medyo anxious, tapos may mga nag-faint. So these are really very minor adverse events for the pediatric group.
Thank you, Yusek, for answering that question. But I think this will be better addressed by the FDA, no? So for the next clarification from Aiko Miguel.
Yes po, Yusek Kabutay, I'd just like to ask also, Secretary Duque said po earlier in an interview, by mid-November daw po we are expecting the WHO SAGE recommendation on booster shots. Are we expecting also the rollout of booster shots for healthcare workers before the year ends with this?
Yes. Yes, Aiko, tama ka. Sabi ko nga, basta meron ng EUA, meron ng SAGE, so we will be ready to roll out immediately. Nagpaplano na tayo. We have our data. We are validating sa ating mga areas, facilities nationwide. Ano yung mga bakuna nila para alam na natin, maibigay natin. As soon as the SAGE recommendations come out the following day, pwede na natin magbakuna sa mga healthcare worker priority. Tapos yung minention kanina, let's look at our immunocompromised.
Yusek, do we have any estimate lang po sa supplies kung ilan pong i-allot for them?
Sinabi na natin kanina, I don't remember, but the healthcare workers about 1.8 yata if you go back to the data. So kayang-kaya yan. We have enough vaccines. Nakita nyo naman yung computation natin kanina, no? 21 million na nasa store. Tapos yung iba, yung hindi na bakunahan, nandun pa sa health. So we will have enough vaccines for our booster for our healthcare workers, be it Sinovac, kagaya ng sabi ko, pwedeng Astra, we will have enough, we will have Pfizer and Moderna, kung ano yung final recommendation. We will have enough vaccines for them.
Sorry, Yusek, Ms. Ferna, last na lang po talaga ito. Are we allowing po walk-ins or bawal po talaga ang walk-ins for the pediatric sector po?
Depende yan sa LGU. No? We leave it up to them. No? Mas gusto nila yung schedule para matansya yung number who are coming. Tapos sabi ko nga yung space, no? Kasi pag dinagsa kayo, nag-walk in, maliit na yung space. But I'm sure depende sa kanilang experience, then they may allow yung tinatawag natin quick substitution list. So parang yung ginagawa sa adult na kung malapit ng maghapon at meron pa tayong mga bakuna, pwede silang magtawag o mag-entertain ng walk-in. We leave it to the local government units to plan how they are going to go about. Of course, as a principal, wala sanang walk-in. Pero sayang naman yung bakuna. Kung meron extra, pwede naman niyang i-bakuna sa ating adults. No? Ang isang ina-encourage natin kung yung kasama ng bata, 12 to 17 na hindi pa nabakunahan at hindi naman magkaroon ng side effect itong bata during the vaccination, pwedeng mabakunahan na rin yung companion o kaya i-refer para sa bakuna. And then later, kung may mga extra vaccines kasi hindi na sumipot yung mga kailangang target natin, pwede sa adult o pwede din sa ibang pedya, yung mga malapit. Dati naman natin ginagawa yan sa mga adult population. So we leave it to the strategies of our local government units.
Thank you po. Thank you, Miss Farina. Thank you,
Thank you, Yusek. Thank you rin, Aiko. So those are all the questions that we can accommodate for today. Maraming salamat po ulit, Yusek Kapatahe, for accommodating our invite, and to all our media partners in the call. And to all, of course, all our Facebook viewers watching us in the live stream. So to formally end this kapihan session, Yusek, would you like to impart anything to our media partners as well as to the public?
Yes, kagaya po ng sinasabi ko sa inyo, maraming salamat sa ating mga media partners. No? You are our instruments for providing the correct information and especially advocacy. Kailangan po natin magbakuna lahat. You can be the inspiration, the role models, no? Na kailangan magpabakuna based on the regular information that we are sharing with you. We have been transparent with our information, our data. Sa mga nakikinig po, kailangan po natin magtulong-tulong para mataasan yung ating coverage ng pagbabakuna kasi pag protektado kayo, protektado ang pamilya, protektado ang bansa. Sabi nga ni Presidente, no one is safe until everyone is safe. So let us all get vaccinated. Maraming salamat. Magandang umaga sa inyong lahat.
Magandang umaga rin po, Yusek, and to our media partners. We'll have our media forum on Friday po. Maraming salamat. Happy lunch.
Thank you.